Hi everyone, a very warm welcome to everyone to our webinar. Welcome from Facebook, LinkedIn, or YouTube. And today we are going to talk about active negative therapy and the use of it specifically in the context of sports rehab and sports performance. But before I bring my product specialists on board to start the discussion, what we'll do is I'll introduce who we are first. Okay, so we are from Boosted Medical Engineering Consultancy, or BMEC for short, and basically what we do is to actually provide you technologies to actually educate, treat, or care for your patients, and also to realize your fullest potential in terms of the healthcare and sports sector. So without further ado, let me bring on board our clinic specialist for today, Faye, to actually get this discussion going. And by the way, for our viewers today, if you have any questions related to whatever that we are going to talk about, please feel free to comment in the comment section below, and we will then answer throughout the talk, or otherwise we'll also just finish up the discussion before we actually go through your questions. So feel free to leave your comments below. Okay, so hi Faye.
Hi Lama, good afternoon, and to everyone joining us today, hello to you all.
Hi, so Faye is our product specialist who will be running through with us the product, but also with regards to the topic. So Faye, let's talk about active negative pressure. So before we even begin, our in-depth discussion, maybe you can introduce what active negative pressure is.
Sure, let's dive right into it. So the best way that I can explain to you what active negative pressure is probably by separating the active from negative pressure. Allow me to explain to you what negative pressure is before we link it to active negative pressure, right? So when we talk about negative pressure, it refers to a pressure that is less than the normal atmospheric pressure, usually achieved through a vacuum or a suction or even a barrier. Okay, so for us to understand what negative pressure is like, okay, let me illustrate it with this. Okay, so assuming that this is a surface, of course, this is a surface, okay, and this surface is subject to equal normal atmospheric pressure. All right. So when we talk about negative pressure, as mentioned earlier, this can be achieved through a barrier, a suction, or vacuum. So we have a cup here, okay, and you place this cup, okay, for a while. Okay, so it's easier for you to see. Okay, so this is a cup which we will be using to apply negative pressure into an area. When you put a suction cup such as this, you place it over this area. Okay? Now, a while ago we mentioned that without the cup and the suction that comes from the cup, this surface has equal amount of atmospheric pressure. When we apply something that has negative pressure, with the suction effect of the cup, the pressure inside the cup is now less than the pressure that's outside the cup. So that is what negative pressure is. You are making an environment wherein a certain area placed under a negative pressure has less than atmospheric pressure compared to the outside or surrounding environment. Right? So that is what negative pressure is. And I hope that's clear. Now, what do we mean by active negative pressure? When we're talking about active in terms of therapy or in sports rehab, we know that it involves movement, right? So, active negative pressure is an application of negative pressure with movement. So it's dynamic. You are not just applying negative pressure on one surface area, but you are able to apply the negative pressure across all areas through movement. All right. And not just that, you are also able to do it with exercise. So while applying negative pressure on a certain area, you can also do exercise while doing that treatment. So that's what active negative pressure is like. It's a negative pressure applied with movement.
Okay, okay, sounds interesting. So
Mhm.
basically, you're saying that negative pressure is, basically a suction on your skin or whatever surface area that you're applying it to. And the reason why we call it active negative pressure is because, um, while applying that suction, you're still able to move the change where we apply the suction on. And how about the opposite? Obviously the opposite is positive pressure. So what are some examples of positive pressure?
Sure. So allow me to show you again this yellow bag. Okay. A while ago, we mentioned about negative pressure. The movement of pressure when you're talking about negative pressure is upward, right? Because it works like a suction. When we talk about positive pressure, the movement of pressure is downward. Okay, downward. So again, we know that without any pressure, this surface has equal amount of normal atmospheric pressure. But when you place something above it and you press on it, okay, the pressure under under my hand now has an increased pressure compared to the surrounding environment. Okay, so it's totally opposite, directly opposite of what negative pressure is. Negative pressure, you take out or you pull out the amount of pressure placed under one area, but with positive pressure, you are adding more pressure to that surface area compared to the surrounding area. So what are examples of this? So you saw a while ago how I pressed on this, right? So when we're talking about sports, you can say that examples of positive pressure therapies would be massage, because we know that when doing sports massage, we're putting pressure, a downward movement from our hands to our patient or client's body. That is increasing pressure from our hands to the patient's skin. So you're creating an increased pressure to that area. What else? There's also we have compression socks or compression garments as well. So in compression, from the word itself, it compresses, and that compression creates a positive pressure in that area where compression is applied. So those are some of the examples of positive pressure. We can also include application of hot or cold baths, which of course we know have other benefits as well. But just in the context of positive pressure, since you're putting on something to the patient's skin, you're applying pressure on that area, and that is positive pressure.
I see, I see. So basically, we are quite used to positive or examples
Mhm.
of positive pressure, like what Faye you have mentioned, massage, compression, and these are commonly used, in sports injuries and in sports rehab. Basically, active negative pressure is basically the opposite of all these examples, which we will delve a little bit more into later. But before that, I also have another question. So because we are talking about improving lymph flow through the lymphatic system, what is lymphatic system and how is it actually related to our overall health?
Sure. Yeah. So it's vital for our viewers to know that as much as our circulatory system or other more known systems are crucial in our body's function, lymphatic system plays a crucial role in maintaining our body function as well. So, what is lymphatic system? Allow me to show you a picture. So it's easier for us to visualize what lymphatic system is. So you see right now, this is how your lymphatic system looks like. It is an extensive network of vessels, nodes, and ducts that pass through all body tissues. And their main function is to clear all the toxins and impurities in the body and plays a role in maintaining fluid balance, fat absorption from our intestines, and play a very crucial role in our immune system response. Okay, so basically the lymphatic flow is like your sewerage system in the body. It drains out the excess fluids we have in our body. And lymphatic flow, from the word lymphatic flow, we know that we're also talking about fluid, okay? Lymphatic fluid. And that's the one that is being collected and being circulated in the body. Like the blood, it moves, okay? So when the lymphatic fluid stops moving, that's when we get problems such as swelling or fluid buildup, which is most commonly known as lymphedema. Okay, so when our lymphatic system has problems, because you know its function, you know exactly what functions will be affected when this system is not working properly. So again, because it's a system that clears all the toxins and drains out all the fluids, you know that when this system has a problem, you can expect swelling or fluid buildup in your body. And this can also slow down your immune response because we just mentioned, right, that it also plays a big role in our immune system. So if there's a problem with our lymphatic system, this also slows down your body's response to viruses or bacteria out there. So yeah.
Okay, and interesting because you know, a lot of us we are, you know, we know of the more common systems, you know, like the nervous system, the digestive system, our endocrine system, and this lymphatic system is something that we are not so well versed in, or that we are not so aware, you know, and so it's interesting to know how the lymphatic system actually works hand in hand together with other bodily functions or other bodily systems to actually help to improve our overall health. And you also mentioned something really interesting, which is basically fluid buildup. And you know, when we're talking about fluid buildup, like what you mentioned, we talk about swelling, so you know, how does it actually impact our recovery? You know, from say surgery or you know by extension sports injuries? Because I mean, today we're talking about we're talking about this topic in the context of sports injuries, sports performance. So a lot of times when we are talking about sports, we are and recovery from sports injuries, we are looking at, you know, increasing or restoring the range of motion, reducing swelling, reducing pain. So how does this lymphatic system actually impact our recovery?
Sure. So since we have mentioned that it functions in terms of maintaining fluid balance in our bodies, say your client or your patient has undergone surgery, we know that the most common response of the body would be swelling. Okay, and if our lymphatic system is not working properly, this slows down the healing process of that surgical area. Okay? So it's not when the lymphatic system is involved in a way that during that healing process, the fluid buildup that comes from the swelling of an injured or post-surgical area, the fluid buildup is not, it slows down the recovery, the treatment time of that area. So when your lymphatic system is not working properly, the main thing that happens is that you are delaying the healing process of that area. You are delaying recovery of that area because the lymphatic system is not able to help you drain the waste and the toxins that is accumulated during that period or that recovery period time. So basically, it decreases the treatment time of your patient. And once you understand the benefits of um, doing of clearing your lymphatic system, you know that it also helps in improving the metabolism of that area. It improves blood circulation and all that. So anything that slows that down will eventually have an effect in the healing process or the healing time of any injured area of the body.
Yeah, you mentioned the time taken for the healing process. It gets delayed if our lymphatic flow is not ideal, and due to all the fluid buildup and the accumulation of waste and toxins in the lymphatic system and the bloodstream. And healing time, or recovery time in sports is really crucial, because basically, as an athlete, we want to be able to shorten the recovery time, or shorten the healing process as fast as you can, so that we'll be able to get back to training, we'll be able to get back to our competitions as quick as you can, because otherwise we would start missing out on key events, and it will affect our whole season or for that year. So yeah, improving lymphatic flow, decreasing the healing time is really important when we're talking about sports injuries and recovery from sports injuries. How about if I'm not injured, but does improving the lymphatic flow actually help with my sports performance?
Yes, I believe so, yes. So much like doing exercise or eating healthy food regularly, it's you maintaining your body at the optimum functionality. So even when you're not injured, especially this is, I believe, is very crucial for sportsmen, because without, let's say, exercise or proper nutrition, you are not able to help your body maintain its best function. So when we're talking about lymphatic system, so those who are not injured, the best word would be preventive. So when your lymphatic system is working properly, you are actually preventing your body from getting more injuries during playtime, and then it makes your system all over system healthy also, which prepares you for any type of activity that you will have to go to. So I think the best answer would be preventive. If you maintain your lymphatic system healthy as well, you prevent yourself from getting risk in injuries and all that. And your body is always ready to fight for any activity or even immunocompromised challenges that you might face during training.
Okay, okay. And you mentioned preventative. It can be used as a preventative treatment, and I guess at the same time it can also be used as a recovery treatment uh, from sports training, or after a really high intensity competition, whether it's combat sports, or team sports, or even endurance sports. But basically, after any high intensity session, whether it's an interval training session or whether it's a competition, uh, you know, there is there is definitely some lactic acid buildup. There is definitely muscle damage in the form of creatine kinase in our lymphatic system, and basically similar to a sports injury. If our lymphatic flow is good, we can then recover from these sessions or these competitions as quick as you can, and to reduce the amount of time spent between recovering between each session or each competition, and at the same time we can maximize our next training session or our next competition.
Yeah.
So thanks for sharing. So thanks for sharing all this so far. I mean, we have covered, what active negative pressure is, how the lymphatic system is beneficial to us, not just for overall health, but at the same time for improving recovery time in terms of sports injuries, from surgeries, and at the same time improving our recovery from sports competitions or training sessions. Are there any evidence, or is this evidence-based? Like, are there some studies or real-life examples of people who have used this type of treatment method or recovery method before?
Sure. Yes. So negative pressure therapy has actually been in the field for many years now. This specifically has been used in wound therapy. So there's this therapy called negative pressure wound debridement. Okay, which has been used for burns or pressure ulcer conditions. And then they use this negative pressure. And then eventually, and that started around in 1990s. And then eventually, from there, studies have been made to show that it can also be applied to other conditions, such as lymphedema. And then eventually, after many more years of trial, since then, it has also been proven to be useful for post surgeries and even recovery treatments for athletes. So yes, it is evidence based. It has been used in different kinds of fields. It can be used for cancer treatment. Can be used for sports, orthopedic conditions, and all that. Yeah. So the use of negative pressure has been there for a long time and has already been studied and proven to be effective, and not just with one condition, but with various conditions as well. And up to this day, there are still ongoing evidences in trials that are being done to prove how effective and how useful this type of therapy is.
I see. Okay, and so like what I mentioned, it has been used extensively in the medical or the clinical setting, and today what we're doing is we are basically taking this treatment option, very much like how we use, like cryotherapy and compression therapy to actually help treat our athletes or our patients in the context of sports injury, sports rehab, and also improving sports performance. So let's get to this product, LymphaTouch. What does it actually do, and how does it actually help to improve our lymph flow?
Sure. So, allow me to show you this short video as an introduction of what LymphaTouch is. Okay. So, your product is called LymphaTouch. It's a product from Finland, a state-of-the-art negative pressure and mechanical vibration equipment. So those are the two main things that it's being utilized. They use cups to achieve the negative pressure to an area and can be applied to several indications or conditions such as lymphedema, swelling, and tightness of the body. Okay, so this is an illustration on how negative pressure is applied over the skin. So the capillary network is activated by moving the anchoring filaments. This causes an expansion in the endothelial holes inside our bodies, and it ushers in the metabolic waste to move into the lymphatic capillary network. This moving in facilitates the pumping mechanism, and the lymph flow is further increased. So you see in this video how our lymphatic fluids is being moved towards a certain area through the negative pressure applied by the LymphaTouch machine. So again, the main purpose is to improve lymph flow, to reduce swelling. It's a multifunction therapy tool. As mentioned, it can be used for several conditions and treatment areas, not just for sports. You can use it for neurology, even for cancer treatments. And it's very portable. As you can see, it's easily carried in a portable bag. And that's it. So the main things that we have to know about LymphaTouch is that it's an equipment that utilizes negative pressure and mechanical vibration to reduce swelling, improve lymphatic flow, as well as treat scar tissues and muscle tightness.
Okay, okay. And I noticed that there are different cup sizes, and you mentioned that you can use it for every body part in that sense. Is that correct?
Correct. Yes. So the LymphaTouch has different size of cups. Okay. So it has a cup size as small as 10 mm to 80 mm. Okay. So there's 5 cup sizes available for LymphaTouch, which suits depending on which area you want to treat the LymphaTouch. So yes, you can use this small cup to treat regular shaped body parts such as your fingers or your face. Okay, and then we also have the biggest cup, which can be used for larger areas such as your thigh or your back.
Okay, okay. And I mean, I have to ask this question because I think immediately when we see these cups, we immediately think of traditional Chinese medicine. We think of cupping. So is it the same as cupping? Or what? Are there any differences?
Yes. So yes, and there is similarities, and there's also definitely there's difference between the traditional Chinese cupping technique and the LymphaTouch. Okay. So first, they both utilize a technique called negative pressure. We mentioned that early on, and with the cups that's being used, this is where the suction or the negative pressure environment is being used to apply to at least a certain area. Okay. How is it different? The LymphaTouch is has a graded pressure. Okay, as compared to your traditional cupping, wherein from what I know, is you use heat to do the suction for a certain area. And that heat applied for traditional cupping is not graded. So you're not able to quantify how much pressure you're applying to a certain area. That is actually why you get those big red marks around your back. And if there's too much heat also, it can also cause you bruising or even some areas to bleed. Okay, so the main difference between LymphaTouch and cupping would be that the pressure that you're applying with LymphaTouch is graded. The amount of pressure that can be used with LymphaTouch is actually from 20 millimeter mercury up to 350 millimeter mercury. Okay, so you're able to adjust accordingly how much pressure your body needs. Your body or your client's body needs. And you're able to adjust it along the way to determine, of course, tolerance of your patient or your client. Yeah. So it's graded. I think that's the most important word for us to to understand is that it's a graded pressure that comes with LymphaTouch. And also, one more important thing is that you are not just we're talking about active negative pressure, right? So with traditional cupping, the pressure is static. It's only applied to one specific area, and you're not able to move it. But with LymphaTouch, as you also saw in the video that we showed you, that we showed our viewers, right? The pressure applied is across the lymph. It can be moved, and it follows the lymphatic flow of our body. It can be moved during it's dynamic. It's active.
Okay. And you mentioned and you mentioned that it is graded, and I guess this is really useful to quantify, like what I mentioned, to quantify the amount of pressure that we are actually applying on the patient, especially if the patient is doing multiple sessions with us, or we are trying to progress. We are trying to progress each session, and when we have something so specific from 20 all the way up to 350, and we can actually dial the pressure down to the exact number that we want. This makes it really useful for like what you mentioned, multiple patients or multiple types of patients, but also multiple sessions and also multiple therapies, because basically it's easy to communicate the treatment that we are giving to the patient among the therapies itself as well. And of course, while cupping versus LymphaTouch, they both use cups. They are quite different, like what you pointed out, and at the same time, there's also that mechanical vibration that LymphaTouch also offers, besides which traditional cupping cannot. So how about is there any like pain, or what are the contraindications for using LymphaTouch? Because we are using suction. Is there like any pain involved? Is it safe?
Sure. So we have tried it to a number of patients and clients already. And the one thing that we always get is that even at the highest, I mean, for at least for those who can tolerate the highest amount of pressure, the suction feeling is very gentle. So what's good about this machine is that even up to the highest pressure, there's no pain that can be felt, unless of course the patient has sensitive skin or is already in the first place in pain. But what's good about it again is that you're able to decrease it or adjust it depending on your patient's tolerance. So even at 20 millimeter mercury, I'm sorry, you're able to achieve what the machine can do even at that lowest pressure. So yeah, at the highest pressure, it can be used to treat patients who have more tolerance, or or able to take that much pressure. But there's the usual comment would be that even at that highest pressure, it's very gentle. So when you mentioned about what are the usual and the contraindications of the use of this machine, and that includes patients with kidney dysfunction, patients with congestive heart diseases, any active deep vein thrombosis, or any active infection. Other than that, the LymphaTouch is very safe to be used to any type of clients.
Okay. So not many contraindications,
Yes.
and we can use it across a very broad spectrum of patients, or types of patients. And you mentioned also about the battery and how it's portable. How long does the battery actually last, and can we bring it around easily? If say for example we are doing home therapy, or on-site field treatment,
Yes.
how portable is it?
Yeah. Okay, so you saw in the video a while ago, it's very portable. It's inside the square carrier bag, and it's battery operated. you can use the equipment for a continuous 8 hours in a day, and it's not very long for you before it's fully charged. It takes only an hour and a half for the machine to fully charge. Yeah, so it's very portable. It's easy. I don't think it would last you 8 hours in one treatment day. So I think 8 hours of continuous use should be enough for one day.
Okay, okay. 8 hours is quite a long time for treatment. You can see quite a lot of patients because maybe when we use LymphaTouch, it's not for an entire hour in that sense. Is that correct? We use it for like say maybe 20 minutes, 15 minutes.
Depending on the area that you're treating.
I see. And it's of course in conjunction with other treatment options as well. Is that correct? Okay. So how do we actually use this in terms of, or how is it different in terms of other treatment options, and can we use it in conjunction with other therapies? So when I talk about say other treatment options or other therapies, I'm referring to say, for example, your hot or cold packs, strapping, electrical stimulation, manual therapy such as joint mobilization and massage. How do we actually use LymphaTouch in conjunction with all these other therapies, and how do they differ?
Okay. So I believe there are a few things we need to discuss in answering this question. First is its application. Okay. So again, this machine is utilizing negative pressure, which is opposite to how how other treatment options are being used. Okay. Second is that with the different cup sizes, you're able to treat areas that are usually hard to treat with other modes of therapy. Let's say we're talking about compression sleeves. For compression sleeves, if we're treating swelling on a certain area, you are only able to apply those sleeves within the whole limb, let's say in the upper arm or in the lower leg. But it cannot be used. I mean, there's no sleeves that can be used in your trunk or in your face, right? So the advantage of the different cup sizes would be that it's able to treat hard to reach areas in our bodies. And it's more localized. The treatment is more localized. So you don't actually have to go through to think about other parts of your body, but you can focus on treating the area that needs to be treated because of the number of cup sizes that you can use depending on where you want it to be used. And also, let's say when we're talking about hot or cold therapy, we know that these modalities are being used as treatment for acute or chronic conditions, right? And we know that it's only targeting the superficial area of our skin. So with the LymphaTouch, we mentioned earlier about the mechanical vibration. So with the mechanical vibration that the LymphaTouch has, it's able to penetrate deeper tissues in our skin. So in terms of the level of skin penetration that it can go, you are able to treat more deeper tissues with your LymphaTouch. And we know that usually in sports, conditions are not just superficial. It can be in the deeper tissues also, right? You get the nodules, the thought bands. Sometimes, it's underneath the superficial area of the skin, and with the LymphaTouch, you're able to target those areas as well, which of course helps you in your treatment and improves your treatment outcomes as well. The other question was how do we use it in conjunction with those therapies? The answer would be again, yes, you can use it as a complement therapy with the other modalities that we have mentioned just now. Okay, so take um, post basketball game. You can use icing first for your client to decrease inflammation and swelling as a result of the game. And then later on, treat that area with LymphaTouch. So it's a complementary tool with the other modalities as well. You can use it as a standalone, but you can also use it in conjunction with other modalities, of course, to achieve better outcomes for your patients and clients.
I see, I see. Okay, so basically it is a form of LymphaTouch, or using LymphaTouch is a form of treatment. And like all other treatment options out there that we have mentioned, there's a specific time or there's a specific phase where we actually use LymphaTouch in. Similar for like our manual therapy, or like cold compression, hot compression, and electrical stimulation, and all these other options out there. And just running by the example that you gave, which is post basketball game. I guess a real life example, or rather, to put it in that context again. We can use icing. Say for example, if say the basketball player is injured, twisted his ankle in the basketball game, we can actually use cold compression first, which is essentially our RISE protocol: rest, ice, compress, and elevate. And then after that, half an hour later, then start using LymphaTouch to actually increase that, get that lymphatic circulation going to quickly start the process of healing. And that would be for, in the context of sports, of getting injured in a basketball game. I think we can also use it in terms of, say, again, using the basketball game example, but not injured. The basketball player has just gone through a really intense basketball match, and his right calf muscles were cramping, especially towards the end of the match. He has another match to play the next day, and so to actually speed up the recovery process, what we can then do is to use cryotherapy, or say an ice bath, to actually to reduce the swelling, to reduce the muscle damage in the body first, or in the calf specifically, and then after that, an hour later, use LymphaTouch to then get that circulation going, the lymphatic circulation going, to actually then reduce that lactate, to reduce the lactic acid levels in the bloodstream, and in the muscle itself, and also to reduce that muscle damage, and again speed up the process. So again, it can, like what I mentioned, it can be used in conjunction with different treatment options itself. And there's also something else that we can use for. Is there like a dynamic treatment option or dynamic therapy?
Yes. So we actually mentioned early in this webinar about active negative pressure, and that involves movement, not just movement from the therapist's hand using the machine, but you can also use this equipment with dynamic movements, such as during exercise. And here's some videos of examples of dynamic therapies. Yes, so you see here an example of a treatment or with the use of LymphaTouch during exercise, during push-up, shoulder abduction, and even knee flexion, a facilitating knee flexion. So we know that active movement is very crucial, especially in sports. Actually, in all kinds of treatment, it's a lot better than passive treatment. So in conjunction with that, you can use lymphatic flow, lymphatic LymphaTouch to improve lymphatic flow while we're doing and activating the muscles through active and dynamic movements.
I see. So that is another interesting treatment method that I guess as a therapist, we will need to learn and in order to maximize the device as well. But I mean, it's really interesting and it's really good that we actually have this option to use it dynamically. Whether we want to improve our lymph flow with while improving the patient's range of motion, or basically activating the muscles as a second heart to actually pump the waste back to the heart as well to actually waste removal. And maybe at the same time trying to answer this question from our audience, Amy Kyo, who actually asked about, and if you can pin that question, that would be great. How do we actually know which size of cup to use for a specific body part or specific treatment?
Okay, that's a very good question. So yeah, it's basically knowing if the cup is able to cover that area properly, because the machine will not work if the cup has an open air or it's not completely in contact with the skin. So like let's say, for example, this cup, that it won't be effective in using with my face, because the cup, when I put this cup over my face, the cup size will not be in complete contact with my skin. So easiest way to answer the question would be knowing the part of the body where you want the cup, where you want LymphaTouch to be used, and making sure that the cup is in contact to your skin. Anyway, what's good about LymphaTouch again is that you are not able to function, make the pressure work when the cup is not in contact properly with the skin. So only when the cup is properly placed and in contact with the skin is it able to release that negative pressure on that area.
I see, and the device will prompt you to adjust the size or to adjust if say the cup doesn't fit the skin well. Is that correct? Okay. So it's actually quite straightforward to use in the sense that if the cup size is the wrong size and there isn't a proper seal, because we're talking about trying to introduce negative pressure to that area. The device will actually prompt you to change the cup size. Okay, that is really that is really good. And I think the last question that we have, are there any like alternative options to LymphaTouch, and what are the differences to LymphaTouch?
What are the other alternative options? We mentioned about modalities such as hot and cold baths, which can be used in either acute or chronic conditions, or acute or chronic phases of the injury or recovery. You also have compression sleeves, which we mentioned a while ago. But of course, with compression sleeves, you're not able to treat irregular shaped body parts of our body. And then you also have bandaging. Bandaging are also being used. There's also sports massage that's being utilized also right now by sports therapists during recovery. So those are the
Okay, and these are all positive. Of course, these are all opposite of all these alternatives are all opposite of LymphaTouch, which is basically
that would be the
pressure.
Correct.
Yeah. And in terms of negative pressure, the only alternative option out there for negative pressure would be cupping. Is that correct?
Cupping, yes.
Okay,
which is
but like what?
from what we mentioned, it's static, and you're not able to quantify how much pressure can be applied to a patient's body.
Yeah, understand. So I mean, I hope our audience also understands or has a better idea of active negative pressure, what it's about, how it's actually different from the other options out there in the market currently, how it actually helps with our lymphatic system in terms of overall health, improving, or reducing the recovery time for sports injuries, improving recovery during for sports performance between matches or between training sessions, and how each and every one of these are actually treatment options that we can offer to our patients or to our athletes, or even for ourselves if we know how to use them to actually help with a really broad spectrum of conditions and whether it's in the medical clinical field or even in the sports setting as well. Just like to quickly address some of the questions from our audience. I believe some we have already covered. For example, like the contraindications when using LymphaTouch. We have and of course the cup sizes. I think there's this interesting question from Lymph, who actually asked, and again, if you can pin the question up, that would be great. Who asked, have you actually used this, or can this machine be used to actually clear the blockage, for breastfeeding moms? Okay, this is not in the sports setting, but
Yes. I'm not exactly sure if there has already been an instance where it's used for this. But what's good to know is that it's actually safe to be used in that area as well. Because as mentioned earlier, this is also being used in oncology. And when in oncology, right, we're talking about breast cancer, after mastectomy and all that. And this machine is actually being used to treat those areas after mastectomy, because that there's tightness, and there's also fluid buildup in the limbs after mastectomy. So when you're talking about blockage, I believe that this will be able to help in the sense that you're talking about the tightness that can occur after breastfeeding. And it's good to know also that it's actually safe to be used around that area as well, because it's being used already in that area. So there shouldn't be an issue, but you can leave a message. You can send us a PM on that, and we'll be happy to get back to you on more detailed information regarding your question.
Yeah, that's a really great question, and I guess it's it's not really talking about in a sports setting, but I think it's a good question because then is another use for LymphaTouch and Lymph, if it'd be great if you could. I mean, it'd be great if you could leave us a message, and we'll get back to you once we actually confirm. With the manufacturer as well. Faye, you mentioned about using it in terms of cancer treatment, or sorry, after mastectomy, for lymphedema, and I guess again not in a sports setting, but we actually have you actually have seen therapists who have actually used who have actually used LymphaTouch in conjunction with manual lymph drainage massage to actually help with the lymphedema that they are encountering. Okay, so that's great. One last question from Emilo. Yes. Do you actually provide a demo trial, and can we actually rent this system, or how does it work?
Yes. The answer to those two questions is yes. We do have a demo trial. We do provide demos and trials for anyone interested to see how the machine works and get a try to use it for their patients or clients. And yes, we also do rental for this machine as well.
Okay. So I guess to yeah, if you haven't I don't think there are any other questions in the comments, but I guess for everyone out there who is listening, if you have any questions in terms of other questions, more questions with regards to the use of the product or even the users, the applications of the product, or just like what Emilio has mentioned in terms of pricing, rental, demo. Feel free to scan the QR code there. We'll bring you to our inquiry form where you can then send us a question. You can address it to either both of us or myself or Faye, and we would be happy to reach out to you to actually answer your questions. And if you request a demo, we'll be happy to also show you as well. So I think with that, thank you, Faye, for this discussion. Thank you for answering the questions. And thank you to our audience as well who have actually stayed on all the way. I hope you have a better understanding of what active negative pressure is, how using LymphaTouch would help with our lymphatic system, our lymph flow, how the lymphatic system is actually important to our overall health, and to help with sports injuries, sports performance, and how we can actually use this treatment modality to complement the other treatment options that are more commonly used out there now. So whether you are a doctor, a physio, a physiologist, a rehab specialist, or just an individual who is an athlete or takes part in sports regularly or gets injured regularly. Sorry, but whether you're any of these types of people, feel free to reach out to us, scan the QR code, send us an inquiry form, and we're happy to get in touch with you. Otherwise, with that, Faye, anything else?
That would be all. Thank you so much again to everyone who has joined us this afternoon.
Yeah. So thank you again. So I think with that, we have come to the end of our discussion, and we hope to see you again in our next webinar and our next discussion. And you can sign up to receive newsletters from us as well, so that or just like us on our Facebook page, or subscribe to us on LinkedIn and YouTube if you want to know or you want to get notified for our next webinar or our next discussion as well. So thank you, everyone.
Bye. Thank you.
Bye. Thank you.